and welcome back to Dr. Noah's YouTube Update. And so I go through the scientific literature once a week and kind of just review some things that I think are kind of interesting. Here's one topic that we talked about, cancer, and unfortunately the dismal type of treatment for cancer. And we've had Cindy on, and she can maybe talk about her personal experience another time like that. But there's a biotech company here called Genentech, and they have a drug, Evastin, which is very popular. It's $10,000 a month. But unfortunately, there's no science to show it has any benefits. And so, don't confuse me with the facts. So, to their credit, the FDA said, okay, this is nuts. We, at least we have to look ourselves in the mirror as scientists and say, we can't give this false hope, give this a very expensive $10,000 a month. We're not talking $10, we're talking $10,000 that we all have to pay for. And if you have Medicare, you don't have $10,000, so that's part of the reason why we have the big, 14 to, I've heard up to $200 trillion in terms of unfunded liabilities like that. So the sad part is that even the study that Genentech used to actually be able to charge this ridiculous $10,000 a month for breast cancer with no benefit was one study that was able to slow down the tumor growth by only 5.5 months. Okay, remember we talked about what does a patient want to hear about cancer? Not that the tumor size decreased 50 or 80%, how long they're going to live. And when did they live longer? 1 month. So spending $50,000 to $100,000 to live one more month is a tragedy on all different levels, financially, ethically, morally. So that's it. But in follow-up in another study, Medicare came out and stated just 2 days later that they're going to continue to pay for this garbage, even though there's no science. So it just shows you that the drug companies are able to buy any politician, buy any other type of people to be able to do that. So that's kind of sad. Another type of thing, this is something that you always have to be careful about, is charities. Good intentions, we've talked about that, but this was actually consumer alert. Coalition Against Breast Cancer, do not send money. They've taken in over $9 million, and less than 4% is actually doing so-called any good. Most of it just goes for their executive staff members, advertisement, their limos, so we don't want to support that, and we won't go into about cancer prevention. So let's go into the science, because that's what I like to talk about. So this is in Archives of Ophthalmology, June. Oh, that's right. That was just, once again, 2 days ago. This is cutting edge. High daily intake of antioxidant reduces risk of age-related macular degeneration. Now, this is one of the little jokes, I always laugh about. The patients come in, they're going blind, and their drug doctor, their eye doctor, doesn't do anything. And in this study here showing that, once again, this is their quotation. This is, once again, from a peer-reviewed medical journal. This, once again, is something that the eye doctor should be. Ophthalmology, that's their specialty. This isn't, a Golf Digest. This isn't, basically Forbes, financial thing. This is the science. Clinicians should provide dietary advice to susceptible individuals to postpone or prevent vision-disabling consequences of AMD. This is a direct quote from drug doctors, the top people. Now, it does come from the Netherlands, and so, maybe they don't have the same kind of kickbacks as the drug doctors do here, but that's science. Components in grapes and berries help with asthma, another big problem in the Napa Valley and Solano County where I practice like that. Asthma treated very easily, but it's a killer. It's devastating. We've talked about the studies in terms of having kids use the bronchodilators. It stunts their growth, it stunts their immune system. It's garbage when there's natural things. So here's a study published in Journal of Agricultural Food Chemistry, June 2011. Components in grapes and berries help prevent asthma. So these are some things, and we'll talk, we talked about before, about Protandim. Protandim is a antioxidant like no other because it works on the inside, called endogenous free radicals, a million times more effective than blueberries and grapes. Now, that's not to say you should still kind of not eat well, because this works on the outside. We'll talk about it another time. So that's an important factor in terms of helping body be able to do that. Dietary fiber and breast cancer. Yeah, so let's spend $10,000 a month for garbage that doesn't work, that makes people sick. And I forgot to tell you about a little bit earlier about that, is, yeah, it causes death, severe bleeding, severe tears in the stomach, I mean, and increases and elevates high blood pressure. So here's garbage that costs $10,000 a month, doesn't, once again, increases life survival by 1 month, and it kills people. And great stuff. So in this article here, in Cancer Epidemiology, Biomarkers, Prevention, May 2011, once again, this isn't the Reader's Digest, this isn't Prevention Magazine, cutting edge type of research, showing that when you increase your fiber content, you're able to reduce the cancer of breast cancer by 75%. How hard is this? Now let's wait until you eat garbage, be garbage, have cancer, spend, once again, the average cost of cancer is $300,000 to $500,000. Who has that money? Nobody. That's right. And that's why we're in debt. So we wait till that. You give them lots of different things. That doesn't do any good. We're always into prevention. That's what natural medicine, that's what, as we've talked about on my TV show and here, is in China, thousands of years ago, their doctors were only paid when you were healthy. As soon as you got sick, they'd stop paying you. So guess what their motivation is? To get you well. Whereas this system we have is, the longer you're sick, the more money I make. The more complications I make, the more money I make. The more side effects I cause, the more money I make. So you figure which one that you want. And that's the nice thing about functional medicine or natural medicine. We're into prevention, and we try to get to the cause of the problem. So one last one of my favorites, other than Protandim, is omega-3 fatty acids, fish oil. So fish intake associated with reduced risk of type 2 diabetes. Now we've talked about that earlier on. Actually, we did a segment, I think, 1 or 2 weeks ago on type 2 diabetes and actually type 1 with Protandim in terms of helping reduce that particular type of complicating factors. But type 2 diabetes, now listen to me, is 100% curable. It's been published in the literature for the last 25 years. Science shows it conclusively that's the factor like that, but people want to continue to believe it's incurable, and the only access to good health and well-being for type 2 diabetes is taking drugs. And we've dismissed that. I've made that offer to any drug doctor to come on to dispute that, $5,000 to their charity, and no one's ever come because it's a fat-out lie. But once again, diabetes is an epidemic. There's more and more people have it, and that's the tragedy. So the tragedy is, what's the #1 reason for blindness? Type 2 diabetes. Doesn't have to happen. What's the #1 reason for amputation? Type 2 diabetes. Doesn't have to happen. What increases heart attacks and strokes by 250%? Type 2 diabetes. 100% curable because it's a lifestyle problem. And so that's this tragic. So with that happy note there, we'll see you next week. Thanks.